Sometimes we hear, I want to put off this hip replacement absolutely as long as I can. I want to put off this knee replacement absolutely as long as I can. Nobody can tell you when it's time to do it, but there begins to be a window. And the research is showing that there's this magic window of when it's time. And I want to give you a couple things to think about and get back to that. When you find yourself avoiding activity because it hurts too much on a consistent basis, so those bad days are outnumbering the good days by a lot, and you feel yourself gaining weight, it's time to start thinking about doing something. The effect of decreased activity or inactivity is a lot worse than the risks associated with the surgery. You're going to start getting into cardiovascular issues, diabetes, and all the stuff we talked about before, the mental health and everything else. That's one red flag when you say, you know what, I'm putting on weight, life's not fun anymore, I can't do what I want to do. When you're not sleeping, sleep's important. It's important for our mood, it's important for our affect, it's important for our communication skills. It's also when the body heals. And a big study just came out this week, and it was talking about sleep and Alzheimer's disease. People that slept consistently 8 hours had fewer plaques on the brain later in life than people that were consistently cutting their sleep short. Sleep is extremely important to let the body heal. And it goes into this whole snowball effect. When the pain is such that you're not sleeping, your body's not getting its chance to heal, the next day is going to be worse, and you can see this cycle. Everything's feeding into that cycle. The sequelae, the secondary things that occur when you put the surgery off too long. When you spend a lot of time limping, and you walk through the clinic all day and you're limping and you're hiking your hip and you're giving a talk and you're standing like this because it hurts to straighten your leg out, you get tightness in other muscles. You get tightness in the hip flexors, you get tightness in the low back. With the knee, people tend to keep it slightly bent. You get tightness in the hamstrings. With the shoulder, we tend to keep it a little bit what we call adducted or close into the body and slightly elevated. You're going to get tightness up in here. Tightness up in there can lead to headaches. It can lead to a frozen shoulder where the joint capsule around the ball and the socket just locks down, and that in itself can be extremely painful. Tightness is one thing. Tightness can be corrected. Tightness can be stretched out. If you push this too long, you get a contracture. A contracture is a condition where the muscle is locked down. It's got fibers that just won't release. It's usually there until a surgeon cuts it. So, magic window. Tightness we can fix. If you can get your joint to go neutral, but it feels tight, we can fix it. If you lay on your back and your knee won't straighten or your hip won't go down, that's getting to be danger zone time. That either makes the surgery much more complicated, or some folks with a knee replacement won't even do it until you get it straight. That's a big deal, because if you're walking around with a knee that's permanently bent, you suddenly have a leg length discrepancy that throws off the hip and the back. And remember, we talked about the joint mechanics being the key. Suddenly your joint mechanics are out of whack, and you're going to start getting these secondary injuries. The magic window also has to do with strength. When we become less active, obviously we become weaker. A lot of good research is out there showing us that pre-surgical strength is crucial for outcomes. There's a couple doctors in town, primarily spine surgeons, but they'll send people 3 days a week for 6 to 12 weeks pre-surgically just to get the body ready. So strength is crucial. When you start noticing, I'm just weak. If you look in the mirror, in all seriousness, and you see that your cheeks are a different size because one is atrophying, you've lost significant strength, and it's time to start thinking about doing something. Jump ahead to pre-surgical goals. So if you decide, all right, I'm going to do this, what kind of condition does your body have to be in? I would encourage you all with knees and hips to really try to maximize your motion. You want to get absolutely straight as you can with the knee, and passively, meaning you or somebody else pushing on it, absolute maximal bend in the knee. With the hip, you want to check all your motions and see if you get full motion. Not excruciating, but try to get as much as you can. The shoulder's a slightly different story. If you're convinced you are going to have surgery, then you've got to try to get as much as you can, depending on the condition of the rotator cuff. So the shoulder's slightly different. You want to possibly get a pulley. You want to do exercises to maximize your motion, but not push through tremendous pain, because we don't want to saw that rotator cuff when you're doing your stretches. Speaking of the rotator cuff, you want to maximize your strength. I printed out up here some generic exercises. They're good exercises to try if you're pain-free. If you have a more specific question, we can either talk after, or you can shoot me an email, and we can handle it that way. But in general, with exercises, the exercise should not hurt worse as you're doing it. If you're having a knee issue and you're trying to squat, and watch my knee, every time I squat, my knee goes in front of my toes. That's bad joint mechanics. That's going to aggravate an arthritic knee. You want to learn to use the glutes when you squat. So watch my knees now. As I squat, the knee doesn't go in front of the toes. I've leaned back, I've engaged the glutes. That's the key to doing a good squat, and that's probably one of 2 or 3 super important exercises for all of us if we agree that the goal is to live a long, independent life. We do that motion a whole lot more than we think about. Every time you get out of a chair, every time you go into a chair, the toilet. A lot of us may realize going up a curb might not be as easy as it used to. We start to put a hand next to the car, look for the telephone pole near the curb, because we've begun to lose the glutes. Key exercise, a squat, lean back as you do it. The first couple times you may need a chair or something to hold on to, because it does pull you backward, because we don't know how to engage the glutes. Once you learn how to engage the glutes, you'll be able to balance like that all day long. And incidentally, watch a toddler. If any of you have young children or grandchildren, watch a toddler squat down. They do it perfectly. Somewhere between infancy and teenage adulthood, we lose that ability. But my kids, when they were young, they could squat down and play with stuff they shouldn't be into all day long. Now they stand up and do that. The other thing is you get closer. Obviously, we talked about weight control. You want to look at that. You also want to be practical and look at your house. Are you going to need to make the hallways a little bit wider in case you are on a walker or a wheelchair when you come home? You're going to want to check your balance. You might be able to get away with crutches. If you can stand on one leg for 6 seconds, you might be able to get away with crutches. You're going to want to look at your bathroom. A lot of us, our bathrooms aren't wide enough for a walker. Some walkers you can pivot the wheels around and make it a little more narrow. Some of them you're stuck, and you might have to think about taking the door off or some modification to the bathroom. You're going to want to either practice stairs or pull stuff down if you have a 2-story house and start to think about 1-story living for 4 or 5 weeks.